When most people hear the word Ebola, they think of a terrifying disease that makes headlines every few years. But what many don't realize is just how quickly these outbreaks can emerge, and how devastating they can be for the communities at their epicenter, especially in places that are already isolated and vulnerable. In the Democratic Republic of Congo, outbreaks can erupt with little warning, often in remote villages where access to healthcare is limited and communication with the outside world is difficult. These communities are often the hardest hit, as resources are scarce and help can take days or even weeks to arrive. Let's take a closer look at what's happening right now in Congo, and why this new outbreak is causing so much concern among health officials and local residents alike. On September 4th, the Democratic Republic of Congo officially declared its 16th Ebola outbreak. This time, the epicenter is the Kasai province, a region that has not faced an Ebola crisis of this scale before. The announcement sent shockwaves through the country, as people remembered the devastation of previous outbreaks. Since the outbreak was declared, there have been 28 suspected cases and 15 reported deaths, including 4 healthcare workers who were on the front lines trying to save lives. The loss of medical staff is especially tragic, as it not only impacts the immediate response, but also weakens the already fragile healthcare system in the region. With a fatality rate of over 50%, this outbreak is proving to be particularly deadly. Families are mourning loved ones, and fear is spreading almost as quickly as the virus itself. In small villages, the loss of even a few people can have a profound impact on daily life and the community's ability to function. Laboratory tests have confirmed that the culprit is the Ebola Zaire strain, the most dangerous and deadly form of the virus known to science. This strain has been responsible for some of the worst Ebola outbreaks in history, including the massive West African epidemic of 2014 to 2016. Ebola spreads through direct contact with the blood, secretions, or other bodily fluids of infected people, as well as contaminated surfaces and materials. This makes it especially dangerous in healthcare settings where doctors and nurses are exposed to patients at their most contagious. Even a single missed precaution can lead to new chains of transmission. The symptoms of Ebola can appear suddenly and escalate rapidly. Patients often experience high fever, severe headache, muscle pain, vomiting, diarrhea, and in many cases unexplained bleeding both internally and externally. These symptoms not only make the disease difficult to manage, but also increase the risk of spreading it to caregivers and family members. That's why authorities are racing against time to contain the outbreak before it spirals out of control. In response, Congo's Ministry of Health has mobilized rapid response teams to the affected region. The World Health Organization is also stepping in, flying in emergency supplies, medical equipment, and international experts to help coordinate the response. These teams are working around the clock to track down cases, isolate patients, and educate communities about how to protect themselves. One of the most powerful tools in the fight against Ebola is the vaccine. Over 2,000 doses are already on the ground, with thousands more ready to be deployed if needed. Vaccination campaigns are being launched in the hardest-hit areas, targeting healthcare workers, contacts of confirmed cases, and anyone at high risk of exposure. But getting vaccines and medical teams to these remote villages is a huge challenge. Many roads are impassable, especially during the rainy season, and some communities can only be reached by foot or motorcycle. This slows down the response and makes it harder to stop the virus from spreading to new areas. Experts warn that early containment is absolutely critical. If the virus gets a foothold in more populated regions, the consequences could be catastrophic. For now, health officials are urging everyone to follow strict hygiene guidelines, wash hands frequently with soap and water, avoid physical contact with anyone who is sick, and report any symptoms immediately. Community leaders are holding meetings to spread the word, and public health teams are distributing soap, clean water, and information leaflets to every household they can reach. The fight against Ebola is never easy, but with quick action, clear information, and the support of the global community, lives can be saved. Stay informed, follow the advice of health officials, and remember, in outbreaks like this, every moment counts.